When we are thinking about effective treatment for obesity, we measure this in how much people reduce the amount of food that they eat and ultimately how much weight they lose. Now, people can only achieve substantial weight loss and maintain the weight loss in the long term if we treat obesity as a complex and chronic disease. So again, the focus is moving away from weight loss and is moving to health gain. And we only achieve this health gain if we can treat this disease in the long term in an effective way with our treatments, be it nutritional therapies, pharmacotherapies, or surgical therapies. Weight loss can only be maintained if the disease remains in remission. So if we start an effective nutritional therapy and it works by making people feel less hungry and they're able to lose the weight, but we stop the nutritional therapy, then what will happen is patients will become hungry again because the disease is relapsing. And then we ultimately see weight regain. The same is true for medications. If the medications are effective, we need to continue them in the long term. Surgery is the most effective treatment we have, but it's a perfect chronic treatment because although we only do one operation, it actually continues to work every time you have a meal. So we would consider all three of these treatment options as valid, but they only work if we continue them in the long term. So there's not one treatment that is more important than another. Most people think they have to start with a diet or nutritional therapy. That's a perfectly good place to start. But many patients have had multiple diets or nutritional therapies in the past. And therefore, if they want to move straight on to have a pharmacotherapy or straight on to have a surgical therapy, that is perfectly possible and certainly should be allowed. If you want to lose weight because you have a social desire for thinness, you just want to lose weight because you want to look different when you see yourself in the mirror, we do not have very effective treatments for that. However, if you want to lose weight for the purposes of health gain, then we have very effective treatments. So it's really about shifting the focus away from weight loss to health gain. And then we have to work out what are the major health gains that you may wish to have. That could be functional gains, so you want to do more things, go out with your friends, go out with your family, engage in society. That's a very healthy and reasonable thing to do, and we can help with that. Or it may be that you want to improve your metabolic health. You want to put your diabetes in remission, or you want to prevent yourself from developing diabetes, heart attacks, or cancer. Again, that can be achieved with substantial treatments for obesity. When we're thinking about all the treatment options available to us, that includes nutritional therapies, pharmacotherapies, and surgical therapies. Within the nutritional therapy space, we can use any diet that may work, and we have flexibility. We do not think there's one diet that's going to work for everybody, and we have to work with the individual to get the best diet for them. Equally so, we have 3 different medical treatments, and which medication is the right one for you can be discussed during consultation, and we can discuss the advantages as well as the side effect profile to help you make this decision. When it comes to surgical therapies, we have sleeve gastrectomies and gastric bypasses, which are very effective treatments that we can use. And again, we can discuss the advantages and disadvantages of all of these treatments.